Welcome to SeriousTech, Engineering the Future, a podcast where we deep dive into the critical role of domain expertise in shaping successful careers in technology. In a rapidly evolving tech landscape, mastering a specific domain is what sets top engineers apart. Join us as we explore how domain tech is transforming industries with a special focus on healthcare, and hear from experts who have built cutting-edge solutions by combining technical brilliance with specialized knowledge. If you're looking to stay ahead in your tech career, this is the place to be. Joining us today are two esteemed leaders in healthcare technology from CitiusTech. First, we have Harish Rijhwani, the Assistant Vice President with over 2 decades of experience in healthcare IT. Harish has been at the forefront of integrating EHR systems and revenue cycle management solutions, while also bridging academic insights with real-world applications through his roles as a visiting faculty member. His deep understanding of healthcare informatics and advanced analytics promises to offer valuable perspectives on the evolving role of engineers in health tech. We're also thrilled to have Vidya Ramachandran, the Vice President of Delivery at CitiusTech, who brings over 20 years of experience in managing complex healthcare projects and ensuring customer success. With significant experience across both US and UK healthcare sectors, Vidya excels in leading large-scale initiatives and driving digital transformation. Her insights into project management and customer relationship strategies will provide a comprehensive view of how engineers can navigate and excel in the rapidly advancing field of health tech. Welcome, Harish and Vidya.
Thanks, Laurel.
Thank you so
Great
much.
intro and excited to be here. Thank you.
I'm very excited to have you both. It's my pleasure. I'm excited about our conversation today. As I mentioned, health tech being a rapidly evolving field, but from advanced imaging to robotics being used in surgery, engineers are really, if I might be so bold to say, really shaping that landscape of health tech. So I'm looking forward to this conversation. So I'd like to start a little bit about each of your backgrounds and what drew you into the world of health tech. And Vidya, may I start with you?
Sure. Thanks, Laurel. As I said, really excited to be here today. Great question. I would just like to answer that a little differently. It's not what drew me into the world of health tech, but rather what keeps me in the world of health tech. Because to be quite honest, when I took up my first healthcare assignment, it was for NHS UK nearly 2 decades ago. I was almost a fresher at that point in time. So I did not choose the project. I was kind of assigned to it. But since then, I have made a conscious effort to continue in this space. In fact, when we relocated from UK to India a few years back, CitiusTech was an obvious and only choice for me, given that they specialized in healthcare and only in healthcare. 6 years in, I still feel I've hardly scratched the tip of the iceberg. There is so much more to learn and grow on a daily basis. The expanse of the domain, the vastness of the domain, and the tech innovation in this space is absolutely incredible. And cliche as it may sound, we do have a profound impact on human lives, and that's what keeps me going.
Absolutely. That's a great answer. Thank you. And for you, Harish?
So for me also, it was kind of, I didn't choose healthcare in a way, right? So when I started off my journey, I started off as an engineer and I got into an organization, which was called, it was called Sintel. And there I started off in a healthcare project itself. So I've been in healthcare since the beginning of my journey. I worked in different areas, be it revenue cycle management or even the payroll system, which is run for hospitals, the financial systems, along with that, the clinical and non-clinical systems. So all of these actually kept me within healthcare. I've seen a lot of regulations come and go within healthcare. So it's like something new or the other is coming up, because as compared to all the other domains, if I look at it, right, from a digitization perspective, healthcare still has a long way to go. And that's something which you always look forward to in terms of what new you can contribute towards a hospital or any other healthcare organization for that matter.
I like how both of you feel like you've been chosen by the career path, that you fell into it, but you've also fallen in love with it, and looking to see what more is on the horizon and what you can bring to the table. And I think that's really fascinating, and it's great that obviously it has kept you in it for as long as it has. And Vidya, something that you said was that it seemed, CitiusTech especially, but in healthcare tech, it seemed like the obvious choice for you. And in your opinion, Vidya, what sets health tech apart from other sectors in technology? And also, how does being unique in that domain offer a competitive edge?
What makes tech advancements in the healthcare sector really interesting is the domain itself, right? Healthcare is very unique. Tech innovations or solutions in this space have to cater to a lot of aspects. It's, as you said, right? It's one of the most regulated areas with strict laws and standards because we're dealing with patient data. So compliance is an absolute must. Mm-hmm. And again, on those same lines, because you're dealing with patient data and patient lives, the stakes are really high. They have a direct impact on patient lives. There is absolutely no room for errors. Any innovation or anything that within the healthcare space has significant investment, right? Be it right from the ideation phase to design, development, testing, before anything can actually be deployed into production. So all of these different aspects in a way, these different things, when they come together, they develop a unique mindset within our engineers, right? You ask what's a competitive edge? They develop a very unique mindset. They are not only groomed technically, they have a very holistic view, a very different approach to how they view things, right? And that's what I believe sets engineers within the healthcare space, within CitiusTech, apart from whom you would find in any other sector for that matter.
Mm-hmm. Harish, I'd love to know your thoughts on that.
When you look at healthcare, right, one of the points which Vidya also mentioned was the domain. Now, if I look at any other domain, be it banking, retail, you're talking about one specific entity and certain sub-entities which are there. But when you look at healthcare, it's not just the hospital. Primarily, the hospital is treating the patient, but the hospital also interacts with the insurance company. Mm-hmm. They're going to get the medications. There are new medications which come in. That is where your pharma and life sciences come into picture, right? So there are so many different entities which come in together. You also have product companies and medical device companies. So all of them have to cater to a specific regulation. So if you're going to say that, okay, you are an expert in healthcare, practically speaking, that's not possible because within healthcare itself, you have so many subdomains. Yes, you have, like I said, providers, life sciences, pharma life sciences, you have medical devices, product companies. You might have experience in one specific area. You might become very good in provider space, but there's still a lot to explore in the insurance side. Right? That is where that knowledge which comes into together, right? Once you work within provider, how do you expand that knowledge and apply it to the insurance side? That is where you get that competitive edge.
I really appreciate how both of you talked about how many different points get touched, in that domain and subdomains, as you mentioned, Harish. And another thing, Vidya, you were saying how it not only is spanning across such a vast landscape here, but then also how it is impacting human lives and the importance of that. And so I would love to know if there are any success stories that have really made a difference. Like, if you have any really great success stories that have made a difference in human lives. Vidya, may I start with you on that?
Sure. Yeah. I think the first story that comes to my mind, and probably because it was pretty early on in my time with CitiusTech, and I kind of realized the impact of what we do on a daily basis, and sometimes you don't really stop to think about it, right? So I think the first thing that comes to mind is something that's changed and defined how we operate today, COVID, right? So in 2020, when the first wave of COVID hit, it literally crippled US healthcare. We at CitiusTech saw this kind of firsthand as many of our provider clients were grappling with the sheer influx of patients across their different facilities, right? So at that point, in order to help our customers better manage the situation at hand, the CitiusTech consulting and tech team developed a near real-time COVID dashboard that provided information on the total number of patients infected, the number of patients that were being tested on a daily basis within that particular area, how many were coming up to be positive, the daily counts of these patients, the beds available, the PPE kits, the oxygen supply, and every other medical device or medical needs, right? Broken down based on facilities of that particular customer. So what helped the healthcare staff or healthcare personnel on the floor was to be able to take a call on where to divert patients or where to get the medical supply from, right, as the case may be. So for me personally, having provided the team on the ground with the information that helped them take those informed and critical decisions using the power of data and analytics rather than having to work blind was, I think it's one of the biggest success stories in my journey. In fact, even now when I think about it, I get goosebumps, to be very honest, right? So, and I think another most interesting point I would like to highlight is at the start of COVID, our teams had completely ramped down because the customers were diverting their budget for patient care, rightly so, obviously so. So the team that actually developed these dashboards were on the pool. And that also kind of highlights CitiusTech's focus on patient and customer centricity and how we keep that at the forefront come what may. So I think multiple aspects because of which this really stands out for me.
That's a great story. And I could understand completely the goosebump feeling that you get from that. So it's a wonderful story. Thank you. Harish, do you have any success stories for yourself?
Sure. I'd like to share another story if I can. Right. So we work with one of the large dialysis facilities in US, and we've been with this customer for more than 12 years now. Right. In the past 5 years, that's rather 5 years ago, this client came to us and said that we want to build an application which can be used by their dialysis clinics. Right? It's a huge project, and it took us 5 years to kind of build that project from different applications for medications or application which can be used by the nurses for in-clinic dialysis or home dialysis. The different modules which CitiusTech's team was part of. And last year, when the client came back, they came to our office, and one of the points they shared a video clip where they're getting feedback directly from the nurses and the people who are using this application. And one point which was mentioned, right, it really is very close to our heart, that the nurse said that I am saving time. I can see all the information in one screen. Earlier, I had to navigate through multiple screens. I'm getting this information in one place. And what that does for me is I'm able to focus on the patient. Now, that really helps you realize that, okay, you are actually contributing towards saving the life of a patient. That's something really very close to us. So that's what we focus on in terms of CitiusTech.
Those are great stories. Thank you so much for sharing them. And yeah, it's both given very human-centric stories, and how the providers are able to better care for the patients. And Harish mentioned the big project for the dialysis client. And Vidya, I was wondering if you might be able to share with us some of maybe some significant achievements and some advancements that have happened in health tech that you've been a part of.
Yeah. So we talk about health tech today. I think we are at an inflection point, and I see a lot of exciting times ahead. So as you mentioned in the introduction, right, I work with the provider market at CitiusTech. And one of the biggest shifts that we are seeing is with respect to data on cloud. There is copious amounts of data that's being produced, especially post-COVID, right? Through video for telehealth, wearable devices, 3D images, etc. And I think it's become increasingly evident that this cannot be supported by the legacy on-prem architecture anymore. So moving to cloud is an obvious choice for many of our customers. Again, cloud is the backbone for many technologies, AI, ML, big data analytics, IoT. So its adoption within our healthcare organizations fuels innovation, allows for enhanced services, better healthcare outcomes, data-driven decision-making. So these are obviously some of the changes that we are seeing. And finally, I think any conversation in today's time would be incomplete if you do not talk about Gen AI, right? So within healthcare As an example, if you think of a physician with a patient, at the end of the interaction, they have to develop clinician notes. Or let's say a patient is getting discharged after an inpatient spell, there would be a discharge summary now. These are time-consuming, manual-intensive tasks. Now, imagine if the notes are being drafted as the physician is talking to the patient, or you're able to collate all the relevant information from multiple documents and just generate your discharge summary for review. The time that it would give back to the healthcare community is incredible, right? So I think be it for enriching patient care or for productivity, business use cases, Gen AI is here to stay, and it's going to be a game changer. So I think these are some of the things that we should really look out for in the present and in the future times, and that people should equip themselves with.
As someone who, when I worked in healthcare, as someone who assisted the doctors in creating their SOAP notes, I'm very excited about Gen AI use and that creation, amongst other things, of course, and the greater impact that has. But the small scale, yes, how time saving that would be to allow providers to be able to focus on the patients and give the care that they're doing. So thank you. And let's say I'm an engineering student, and I'm going to be graduating soon, and I'm looking ahead to the future. Harish, what types of roles and opportunities does HealthTech offer for those interested in engineering?
So I'd like to answer that question in two parts. Right? Let's assume that you have a focus on growing on the technology space. And when I started my journey, I started off as a mainframe developer. But now, most of the places which you look at it, you start off with something like .NET or Java. You're going to start as a developer, as a software engineer, as a software developer, but you can reach the level of becoming an architect, wherein not only are you developing a solution, but you're actually conceptualizing a solution, looking at what are all the parts which come into picture. Okay? Obviously, this is your general technology space, Java, .NET. But when you look at healthcare, within healthcare, there are a lot of different things which come into picture. There's specific technology stacks which cater to interoperability problems, right? There are different standards within healthcare, which is where you have HL7, FHIR, EDI, all these different standards, and there are different integration engines which come into picture. So you can get into a vast things from being a normal .NET developer to being a data scientist within healthcare. The only difference will be that you're going to focus on healthcare specific information. The other space wherein a lot of people get into also is that you don't want to get into the technical line. You want to focus more on the non-technical space. Obviously, you can become a Scrum Master, but as a junior, you start as a business analyst, wherein your focus would be to understand the business, the domain. From there, you can become a consultant, you can become a healthcare consultant. You can grow into managing projects like a project manager as well. But again, within this, you'll also have the aspect of become a process or a product analyst, wherein you're focusing only on revenue cycle management, or the focus is only on the front office space within the hospital, right? There are different products for that as well. I'm focusing only on the appointment module for that matter. So like this, right, there are two separate pathways you can choose from, wherein depending on your interest, right, you can grow in that specific path as well.
Thank you. Yeah, it sounds like there's certainly multiple paths and even opportunities within each of those paths to take, and depending on what one is interested in. And I'd say, Vidya, how do you think engineers can keep themselves motivated and inspired, because it is such a big domain and it's ever evolving in healthcare tech? What are some of the things that they can do to keep themselves motivated and inspired to advance in this field?
Yeah, Laurel, I'm glad you asked me this question, because this is something I often get asked when I'm speaking with potential candidates, right? So I think essentially what would inspire or motivate people, irrespective of which level they are at, is the ability to learn, grow, hone your skills on a regular basis, and most importantly, have the opportunity to put these into action. So if I specifically talk about CitiusTech, right, we have a very robust practice to which each of our engineers roll up to. So we have the concept of home and host. So while they might be assigned to a different delivery assignment, so that's kind of their host, the home will be their practice that they map to, right? They're learning as a part of their job, but at the same time, they have the opportunity to be involved with multiple innovative cap dev engagements that our strong practice teams run on a regular basis, right? So there is plenty of opportunities from that standpoint, and a lot of room to explore, where their interest lies and what they want to do. If you talk about training and cross-skilling, CitiusTech again has one of the largest training and development repositories within healthcare IT sector. We keep our engineers, our citizens, abreast of latest developments in tech and domain through curated training courses, newsletters, knowledge bites. In fact, to give you an example, we were talking about Gen AI some time back, right? So CitiusTech is working towards being the pioneers in Gen AI solutions in healthcare. We want all of our engineers to be augmented to deliver significant value and be able to solve business critical problems using Gen AI. We have a Gen AI foundation course, and that's mandated for all citizens. And what's interesting is the introduction to this course is by our CEO, Mr. Rajan Kohli, and our COO, Mr. Sudhir Kesavan, right? So that kind of shows and drives home the point, the commitment and belief in this technology, and also the fact why we want our engineers to develop this skill. So I think in summary, I would say there is absolutely no dearth of opportunities for anyone who's within CitiusTech or looking to join CitiusTech to keep themselves inspired, motivated, and well-equipped.
Thank you. Before we wrap it up, Harish, I want to finish things with you and really bring this home. Do you have any insights or advice for engineers that are contemplating a health tech career?
So I'll again share 2 points. In terms of, one would be the domain is really important. As an engineer and as a visiting faculty, I've noticed that engineers primarily focus on the technology, which is correct. But unless and until you don't understand what problem you want to solve, that technology is not going to make a lot of sense. So you need to be able to tie the technology to solving a specific business problem. And the other thing which I'd also like to share is when you're looking at showcasing your experience, right? You show a resume and you talk about that, okay, let's say you worked on a Tableau project. But in reality, what really sells is showing that experience rather than telling that experience. In writing, we have the concept of show, don't tell. And over here, right, conceptually, rather than saying that I built a Tableau dashboard, it makes more sense to show that dashboard. Okay, this is what I've done. I use so-and-so healthcare data. It's like when you go to a shop, you see a chocolate, you like the wrapper, you buy that. Yeah, that's how it's appealing to the eye. That's why you buy it. But in reality, in terms of technology, it's not so easy to sell it. Unless and until you don't try it, you don't show it, it's not going to sell. Which is where nowadays experience is also kind of supposed to be shown in that manner, especially for juniors, that you have to show your experience and you have to be hands-on, you have to keep learning. So yeah, those are the 2 points which I'd like to share.
Perfect. Show, don't tell, and always be hands-on and continuously learning. I love that. And thank you. Thank you, both of you, for your expertise and for sitting down with me today and this wonderful conversation we've had about engineers and health tech. It's a really bright and exciting future for anyone in health tech, but particularly for engineers. So I really appreciate your insights on all of this. Thank you so much for joining me.
Thanks, Laurel. It was great being here.
Thank you so much for having us.
The SeriousTech Engineering the Future podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to CitiusTech's YouTube channel.